Hi, I'm Michaela Hoffmeyer. I'm a senior advisor with MRIGlobal. I have been with MRIGlobal around 2.5 years, and I serve as the lead for regulatory and clinical affairs for our disease diagnostics group. I first knew I wanted to be a scientist when I was really little, because when I was a little girl, I was obsessed with all things nature, and I loved to run around in my dad's garden and pick the flowers and pull them apart and see how they worked inside. As I progressed through college and I got exposure to different careers in sciences, I decided I would be better suited to go to graduate school than medical school. So I went to pursue graduate studies at the University of Texas in Austin in molecular and cellular biology. And it was actually there when I started my graduate work, I realized that my interests were pretty different than my peers. My graduate program, or my graduate project rather, was much more translational. So it was a little closer to the clinic than a lot of the work that my peers were doing, which was more pure research or basic research. When I wrapped up my studies at UT Austin, I knew I wanted to maintain that closeness to the clinic, and I entered the workforce as a research scientist for a major in vitro diagnostics company. And since that time, I moved up to leading R&D teams and spent 15 years in commercial diagnostic development. So now at MRIGlobal, as a senior advisor, I help our government and commercial clients navigate the diagnostic product development process and navigate the regulatory side of that as well. So because I have this background in commercial diagnostic development, I help our clients understand what the FDA's expectations are for design control, which is a process that they have to follow when they're developing their diagnostic test. I help them with formulating regulatory strategies and clinical strategies, and preparing documents for the FDA, preparing study designs that will meet FDA's expectations. Right now, a lot of my clients are, of course, very focused on COVID-19. So we do a lot of emergency use authorization work for diagnostics companies. But that's starting to change now. I mean, we're getting away from EUAs, or emergency use authorization, and we also support clients in getting full clearance from the FDA or other regulatory agencies outside of the United States, whatever the case may be. I think the thing I enjoy most about MRIGlobal is the variety of different technologies we get to work with. So while all my projects are diagnostics, I get to work with all different types of technologies, cutting edge molecular techniques, serology, antigen, lateral flow, things that have not come on the market yet or have ever been seen before. And they range from very high complexity tests that run on automated systems with very high throughput, all the way down to the other end of the spectrum with very simple to use type of test that's capable of getting CLIA waiver or at-home designations from the FDA, like an over-the-counter, for example. That would be the kind of test that you could go over to your local drugstore and buy and run in the convenience of your own home. So, that kind of diversity is really interesting. And I love to help my clients, have a successful product and get through the FDA.